So I just had my second scan since I started my treatment for exon 20 lung cancer. My first treatments began in late December with the full dosage of carboplatin, pemetrexed, and amivantamab. And then due to platelet and neutrophil drops, we moved to amivantamab and a reduced dosage of pemetrexed. And nothing's changed. I haven't been able to tolerate the carboplatin since. So the first scan that I had 2 months ago showed maybe 20 to 25% shrinkage of the primary tumor. My brain mets look like they're definitely not progressing, and they're getting smaller or staying stable, probably necrotic. And there's no other cancer in my body right now. So the second scan showed that the tumor is now stable. It hasn't gotten any smaller. I do want to make a big point today to say that if you take nothing else away from this video, it is so important not to look at the scans before you talk to your doctor. I would have lost a whole week of happy days, not worry-free days if I had looked at that scan, because the radiologist chose to view my tumor as having gotten slightly bigger. And my oncologist said that we consider it stable. It's like a hair's breadth, maybe, but you can measure it in a way that it's not gotten any bigger. So this is what we've been hoping for. Amivantamab does its most work in the first couple of months, so you'll see the most regression that time. And at this point, we're going to see if I'm a candidate for surgery. The landscape for stage 4 lung cancer in terms of treatment has shifted to include surgery as a new standard of care, or we're headed that way for sure. So after a PET scan and another brain MRI, we'll pass everything along to the surgeon and see what they think. If I'm not a candidate for surgery, if there's new disease or the tumor is getting bigger or it's in a spot where they can't remove it, then I'll get radiation. All of these things are designed to add months, if not years, to my life. We use one medicine until it stops working, and then we try another. Not as many medicines for exon 20 as there are for other forms of lung cancer, but the story has not yet been written. That much I'll say. So to all of you who are struggling along this journey with me, I send all of my love and healing energy. Love to all.